Hello everyone, this is Sharmia. In this video, we are going to see about what is meant by jaundice. Jaundice means it's a yellow discolorization of the skin, our sclera, eyes, and mucous membrane due to the hyperbilirubin and deposition of the bile pigments in the blood. It's usually detectable clinically when the plasma bilirubin exceeds 50. We can consider this patient as a jaundice. Jaundice is not some disease, it's a sign of underlying diseases. Okay, it's jaundice means it's a yellow discolorization. Yellow discolorization means yellow like pigments will be deposited in our skin in all our organs, but it is easily visible in our skin, sclera of the eye, and mucous membrane. In these areas, we can easily detect the difference of yellow discolorization. In this, we can consider the patient as jaundice. This is due to the hyperbilirubin, increased hyperbilirubin in blood. Hyperbilirubin is a yellow pigment, so that if when it increased, it appears as a yellow color in our skin. Jaundice is not a disease. It is and it denotes that there is a problem in the RBC, blood related problems or liver related problems or gallbladder. Any problems means it is the problems in this areas, these organs. It is denoted as a jaundice. Yes, normal skin. Here it is normal skin is but yellow skin. Jaundice, the skin is yellow. Yellowing is associated with the accumulation of the bilirubin in the skin. Most often caused by liver. Yes, liver, gallbladder disorders or blood disorder, RBC disorders will they are denoted as a this yellow pigmented jaundice. First of all, normally our RBC can live for 120 days. After that, RBC is produced from the bone marrow. After 120 days, after circulating for 120 days, it is destroyed. Next, antiglobulin is converted. Antiglobulin will the amino acids will be used for next RBC production. Will go for next RBC production. This heme will be converted to biliverdin. Next, biliverdin, green pigment. Hemoxidase is an enzyme which converts this heme to biliverdin. Next, biliverdin reductase will convert it into unconjugated bilirubin. Yes, and the liver unconjugated bilirubin is converted. Next, it is converted to conjugated bilirubin. Conjugated will be converted to unconjugated will be water insoluble. It cannot excrete. Next, only it is converted to conjugated bilirubin. It is water soluble. Next, this bilirubin will attach with the bile. Bile is produced in the liver only, no? It will attach with the bile and it will stored in the gallbladder. When food enter into the intestine, this bile will secrete. During this time, this bilirubin also secreted in the intestine. This intestinal bacteria will convert the bilirubin to urobilinogen. Urobilinogen is excreted in the urine in kidney, and next some are converted to stercobilinogen. Stercobilin is excreted through the fecus. This is the normal process of the bilirubin. If when there is a problem in this unconjugated to conjugated conversion and conjugated bilirubin to be stored in the storage problems, unconjugated bilirubin conversion, this can cause the jaundice. Next one, types of jaundice. There are three types of jaundice. One is prehepatic, next one is intrahepatic, next one posthepatic. Prehepatic means rising from the blood before it enters the liver. As pre means prehepatic. Hepatic denotes the liver. Pre means before the liver. Intra means interior, inside the liver. Post means after the liver. Pre means before the liver, before entering the liver, this is the blood. It will denote some blood disorder. In this condition, serum total bilirubin will be 5 to 17 micromole per liter, 0.3 to 1.0 mg per day. Intrahepatic means it denotes the liver disease in the liver parenchyma. Serum total bilirubin is 50 to 350 micromole per liter, 0.3 to 20 mg per day. Post-hepatic, the result of obstruction of the it will denote the gallbladder. There's problem in the gallbladder. Serum total bilirubin is 100 to 750 micromole per liter, 0.6 to 45 mg per day. Epidemiology. Epidemiology, the main prevalence of the jaundice is depends upon the age and sex. Newborns and older adults are mostly affected. Approximately 20% of the newborns will develop the jaundice in their first week due to the immaturity in the hepatic system. Congenital abnormalities, hemolytic bilirubin uptake disorders, and conjugation defects are responsible for jaundice in infants or children. Viral hepatitis A is the most frequent cause of the jaundice among school-age children. Common duct stones, alcoholic liver disease, neoplastic jaundice occur in their middle age and older patients. Etiology. Based upon the site, prehepatic means increased heme liberation. Main causes hemolytic anemia, malaria. In malaria, RBC destruction is more increased than RBC production. Hemolytic anemia also like this only. Reduced RBC lifespan. Jaundice is caused in childhood, mostly affect the child because RBC's lifespan in adults is 120 days, but in childs there will be reduced lifespan like 60 to 90 days, so that destruction will be more compared to production. Next one, intrahepatic, due to the defective liver metabolism. Causes are congenital enzyme defects, iron storage disease, reduced hepatic bilirubin uptake. Next one is obstructions of the small bile ducts. Alcoholic cirrhosis, autoimmune liver disease. Autoimmune liver disease means our own WBCs will attack our liver. Drugs and environmental chemicals, hepatic tumors, pregnancy, viral or other infections, gallstones, primary biliary cirrhosis. Post-hepatic obstructions of the large bile ducts, infections or inflammation of the biliary tract, gallstones, carcinoma of pancreas, gallbladder, bile duct, pancreatitis, inflammation of the pancreas due to drugs. Drugs which are cause the jaundice means dose-dependent hepatocellular damage, acetaminophen salicylates, high-dose tetracyclines. Dose-independent means the hepatocellular damage includes disulfiram, isosulfiram, sevoflurane, dantrolene, ketoconazole, and antidepressants, aminosalicylic acid, isoniazid, pyrazinamide, ethambutal, antituberculosic drugs, hemolysis, methyl dopa, mefenamic acid, cholestasis, carbimazole, oral contraceptive, sodium orothiomycin, chlorpromazine, chlorpropamide, erythromycin acetylate. Pathophysiology, main causes sickle cell anemia, blood transfusion, hemolytic drugs, hemolytic anemia. Main cause of prehepatic hemolytic is due to the more destructions of the RBCs than RBC production. So that in this case, unconjugated bilirubin will be this heme will converted to biliverdin. Next, biliverdin will be converted to unconjugated bilirubin. But liver cannot process it more unconjugated to conjugated bilirubin. So that the level of unconjugated bilirubin will be increased. It will deposit in the uh, blood so that yellow pigmentation. This is called prehepatic jaundice. In intrahepatic, the liver damage, so that liver will conjugated bilirubin will be produced less only, but the liver cannot process it more of this less into conjugated. Some conjugated it can produce, some it cannot produce, so that there will be both increase. Conjugated also increase, conjugated also increase, and it will deposit in the blood and yellow pigmentation. It is called intrahepatic jaundice. The liver cannot process, save the conjugated, to store the conjugated to uh, gallbladder also. In the next, uh, post-hepatic. Post-hepatic means there will be stones in the gallbladder stones, so that the liver cannot store the conjugated to the gallbladder. So conjugated bilirubin level will be increased in this yellow pigmentation. Causes of jaundice. Jaundice occurs when there is too much of the bilirubin is produced from the liver and unable to remove from the blood. For example, patient with hemolytic anemia have a abnormal rapid rate of destruction. Yes, there will be more destructions of the RBC, so that large amount of unconjugated bilirubin is produced. Instead, debate in the liver, it will prevent the removal of the conversion of the unconjugated and conjugated and storage of the conjugated, so that both unconjugated and conjugated will be increased in the blood. Next, blockage of the bile ducts. The decrease the flow, because due to the stones of in the bile, in the gallbladder, so that the conjugated will not be stored, so that increased levels of conjugated bilirubin will in the blood will be increased. For example, the bile duct can be blocked by cancer or gallstones or inflammations of the bile ducts. The decreased conjugation secretion or flow of the bile that can result in jaundice. It's referred to the cholestasis. However, cholestasis does not always result in jaundice. Next is signs and symptoms of jaundice. Common signs are already seen: yellow discoloration of the skin, mucous membrane, oids of the sclera of the eyes, light colored stools, dark colored urine, itching of the skin, nausea, vomiting, abdominal pain, fever, weakness, loss of appetite, headache, confusion, swelling of the legs and abdomen. It's a diagnosis. The yellowing of the skin and eyes are likely to be the main clues a doctor will use before confirming a jaundice diagnosis. They will see the yellow discolorization. Physical examination will be carried out to look the signs of swelling of the liver and legs, ankles and feet, which might indicate cirrhosis of the liver. Hepatic virus panel to look for the infection of the liver. Liver function test is taken. Complete blood count. If there is low blood count, means anemia is detected. Abdominal ultrasound, CT scan for if there is any different diseases in the liver, means it's noted as ultrasound, CT scan, MRI scan, liver biopsy for cancer. Diagnostic test, function test, total bilirubin, prehepatic, there will be normal or increased. Hepatic jaundice and post-hepatic, it will be increased. Conjugated bilirubin, it will be in prehepatic normal, but hepatic and post-hepatic it will be increased. Unconjugated will be normal. It's in hepatic, post-hepatic increased, hepatic increased, post-hepatic it will be normal. Yes. Then neurobilinogen will be normal or increased in prehepatic. Hepatic it will be increased, and post-hepatic it will be decreased. Urine color and prehepatic normal. Hepatic will be dark urobilinogen plus conjugated bilirubin due to as post-hepatic dark conjugated bilirubin. Stool color will be normal in prehepatic jaundice. Hepatic jaundice will be normal or pale color. Post-hepatic will be pale. Alkaline phosphatase levels and alanine transferase and aspartate transferase level will be normal in prehepatic jaundice, and hepatic and post-hepatic will be increased. Conjugated bilirubin in prehepatic jaundice is not present, but hepatic and post-hepatic jaundice will be present. Splenomegaly and prehepatic jaundice is present. Hepatic and post-hepatic also it will be present. Prevention of jaundice. Due to the wide range of potential causes, it's not possible to prevent all cases of jaundice. However, there are four main precautions that you can take to minimize the risk of developing jaundice. They are ensuring that you stick to a recommended daily amount for alcohol consumption, maintaining a healthy body weight. If appropriate, ensuring that you are vaccinated to hepatitis A and B. Vaccination would usually only be recommended depending upon the world you are traveling. Minimizing your risk of exposure to hepatitis C because there are currently no vaccine for this condition. Gilbert syndrome jaundice. It's a harmless hereditary condition that results in mild jaundice during times of illness or stress. People with the Gilbert syndrome will experience low levels of some bilirubin processing enzymes in their livers, according to lab test. Alan Darton, once diagnosed, Gilbert syndrome does not require further medical treatment. Dubin-Johnson syndrome, autosomal disorder due to deficiency in transporter protein MRP2 to transport conjugated bilirubin from hepatic cells to gallbladder. This leads to the buildup of conjugated bilirubin in hepatic cells. Compensatory mechanism, regulations of transport mechanism by MRP3 protein that bypasses conjugated bilirubin to blood, passes to kidneys, producing even darker urine. Neonatal jaundice is clinically detectable in the when the serum bilirubin levels are greater than 85 mol per liter. This occurs in approximately 60% of the term infants and 80% of preterm infants. Neonatal jaundice first becomes visible in the face and forehead. Blenching reveals an underlying color. Jaundice then gradually becomes visible on the trunk and extremities. Signs and symptoms of the neonatal jaundice will be poor feeding, lethargy, changes in muscle tone, high-pitched crying, seizure. Next, jaundice in pregnancy. Cholestasis of pregnancy. Cholestasis of pregnancy is an uncommon condition that occurs in the pregnant woman during the third trimester. The cholestasis often is combined by itching by infrequently causes jaundice. There also an association between cholestasis of pregnancy and cholestasis caused by oral estrogens, and it has been hypothesized that it is the increased estrogens during pregnancy is responsible for the cholestasis of pregnancy. Acute fatty liver of pregnancy, it's very serious complications of pregnancy. It occurs in late of pregnancy and result in failure of the liver. It can almost always reversed by immediate delivery of the fetus. There is increased risk of infant death, and jaundice is common, but it's not always present in acute fatty liver of pregnancy. Prevention, ensuring that you stick to management. Treatment may consist of expectant management at home with rest, medical treatment with intravenous fluids, medications, antibiotics, or blood transfusion may be required. If the drug or toxin is the cause, there must be discontinued. They must be discontinued. In certain cases of newborn jaundice exposed in the photo therapy or exchange blood transfusion is be required to decrease the elevated bilirubin level. Surgical treatment is also required for obstructive jaundice. Removal of obstructive jaundice, non-surgical extracorporeal shockwave lithotripsy, non-invasive successive shockwave pressure pulses fragment the stones into smaller pieces so they can be easily passed the duct. Endoscopic retrograde cholangiopancreectomy. Insertion of the endoscope up into the ducts in a direction opposite to or against the normal flow of bile down the duct. Next, surgical laparoscopic cholecystectomy, minimal invasive surgery, band-aid surgery, keyhole surgery, or pinhole surgery. Treatment, supportive care, IV fluids is cases of dehydration, medications for nausea, vomiting, etc. like that, and pain, antibiotics, antiviral medications such as acyclovir, blood transfusions, autoimmune hepatitis, steroids, immunosuppressants for chronic hepatitis B, C, different. For fulminant hepatitis, end-stage liver transplantation, liver cancer, chemotherapy, radiation therapy, neonatal jaundice, phototherapy. That's in this video what are we have learned is what is meant by jaundice, and what are the main types of jaundice, and its pathophysiology, epidemiology, etiology, causes, signs and symptoms, diagnostic test, prevention, types of jaundice, management, treatment. Thank you.